Leukemia. Leukemia is cancer of the blood cells. Normal blood is made of a fluid called plasma and 3 types of cells. 1. White blood cells. 2. Red blood cells. 3. Platelets. White blood cells, also called WBCs or leukocytes, help the body fight infection and disease. Red blood cells, also called RBCs, the soft, spongy center of bones called the bone marrow. Blood cells. The leukemia cells usually look different from normal white blood cells, and they do not function properly. There are currently no known causes of blood cells it affects. Lymphocytic leukemia and myelogenous leukemia are 2 such examples.
Acute lymphoblastic leukemia, or ALL for short, is interesting because it's classified into 2 groups which depend on the age of its host. There's adult ALL and childhood ALL. You know, the bone marrow basically makes the blood cells. It starts off by making blood stem cells. Now these stem cells can go on to become one of 2 other stem cells. First off is the myeloid stem, any lymphocytes. As you can tell from this is obviously bad because the lymphocytes are leaving less room for red blood cells, healthy white blood cells, and platelets to do their jobs.
So now we can talk about the different types of acute leukemias. And remember that acute leukemias come from these cells. And we're going to start off by talking about the acute lymphoid leukemias. So I took that big diagram and I shrunk it down and I stuck it into the corner because, to be completely honest, nobody memorizes this diagram by just looking at it 1 or 2 times. ALL, so we don't have to write it all out again. So one of the things that I really loved about learning the different leukemias was that the name of the leukemia told you a lot of the information that you needed to know about it. So the word leukemia tells you that you're dealing with a cancer of the blood cells.
And if you don't have enough normal white cells, you may present to your doctor with infections, for example. So chronic, unexplained, serious infections, fevers, chills. Then also, because of the platelets can be affected, a lot of times patients will present with bleeding or easy bruising. We sometimes see what we call petechiae, which is just a medical small red dot under the skin. That is a symptom or sign of a routine blood test. So some chronic leukemias don't have a lot of symptoms initially. Patients with chronic leukemia may be discovered in the emergency room when they're there for another problem, or they may be discovered in after a motor vehicle accident where you look and you see, hey, you've got too many white blood cells.
So today we are going to undifferentiated cells called stem cells. These stem cells are in the presence of different specific chemicals that actually control their growth. Leukemia is the first type of cancer we are going to cover, and leukemia occurs when there's an uncontrolled production of immature white blood cells or blast cells in the bone marrow. So when we think of immature white blood cells, we also think of our bands and the shift to the left that we can see on diagnostic labs. But leukemia is this uncontrolled production of these immature cells that overcrowd and interfere with the production of our mature cells, which are